So, welcome to the review for the heart in Anatomy 214. As you can see over here, we have the heart in anatomical position with the apex of the heart right over here and the base of the heart right over here. The right atrium, right ventricle. If I flip it over, actually, sorry, just quickly, the aorta and also the pulmonary trunk right over here, coming off of the right ventricle. If I flip it over, you can see the posterior surface of the heart, and the best way to identify that is using the left atrium. So you look for the pulmonary veins. You have the inferior, superior, and the inferior, superior, left and right pulmonary veins, and the left ventricle right over here. If I flip it back over to the anterior surface in an anatomical position, I will quickly review the right atrium, which is a thin-walled chamber of the heart that receives blood from the superior vena cava right over here. So you can see this if I reflect it right there. The inferior vena cava that you can see if I flip this over right over here, so coming from the inferior surface of the heart. And lastly, the coronary sinus, which you can see right over here. So all these vessels drain into the right atrium. Other features of the right atrium that you should note is the pectinate muscle, seen on the lateral wall of the right atrium. Secondly, you should see the crista terminalis that forms the intersection or boundary between the pectinate muscle and the smooth muscle of the right atrium. So unique features of the right atrium are pectinate muscle, crista terminalis. Good way to identify the right atrium. Another feature that I'd like to turn your attention to is the fossa ovalis that you can see right over here. Fossa ovalis that is covered in the adult or postnatal heart. And lastly, the tricuspid valve, or valve entering or allowing blood to enter the right ventricle that I will open up right over here. So features of the right ventricle that you should note is the trabeculae carneae, the papillary muscles coming off of the trabeculae carneae, the chordae tendineae that are attached to the cusps, the cusps of the tricuspid valve. And most importantly, in the right ventricle, what you should note is the moderator band or septomarginal band. And another interesting feature of the heart, or the right ventricle, that is different from the left ventricle is on this heart, you can see the thin-walled right ventricle. And lastly, we can see over here, if I turn the heart in a certain way, is the pulmonary valves and pulmonary trunk coming off the right ventricle. So very important that you orient yourself when you come to a lab station or lab question that shows you the heart. First, orient yourself and find out what surface you're looking at. So anterior surface, posterior surface, diaphragmatic. Moving our attention to the posterior surface, we will focus on the left atrium. And what you should notice in the left atrium is that there's no pectinate muscle and no crista terminalis. It is all smooth muscle and thin-walled. So if you see something with no pectinate and no crista terminalis, you know you're in the left atrium. And also you can note the pulmonary veins, 4 of them. Inferior, superior right, inferior and superior left. And lastly, you should note the bicuspid or mitral valve right over here. Okay, so 2 cusps instead of 3, so another unique feature of the left versus right sides. Focusing our attention on the left ventricle, you can see the papillary muscles, the chordae tendineae attached to the cusps of the bicuspid or mitral valve. And also you should note the difference in thickness versus between the left and right ventricle. So just to have the right ventricle over here, very thin-walled, and when I flip it over and look at the posterior surface, you can see that when I open up the right ventricle, that it's a much thicker-walled myocardium. So very important that you notice this. You can see the papillary muscles, trabeculae carneae, chordae tendineae, bicuspid or mitral valve cusps, and there is no moderator band in the left ventricle. So those are the main features of the heart and its chambers. And lastly, I would just like to show you, if we can see it over here. So you can see my finger coming through the aorta. So you have the aortic valve right over here. And if you look inside the aorta, you can see the aortic sinuses that would be located right there. So there were 3 of them. So both the pulmonary trunk and the aortic, pulmonary valve and the aortic valve have 3 cusps. And right over here you can see the aortic sinuses in the aorta, or ascending aorta, right over here.